Today on Rare Disease Day, we are visiting the Leiden University Medical Center. We plan to congratulate the initiators of the Dutch Center for RNA Therapeutics with the opening of the center and ask them what the new center will do for patients with Duchenne muscular dystrophy and ultra-rare diseases. We're very excited about this new center, and would you mind to tell us a little bit more? What is the goal, how it started?
So we have now more than 20 years experience with developing exon skipping for Duchenne muscular dystrophy, supported mainly by the Duchenne Pen project. And that means we have experience with developing exon skipping compounds and testing them. And in the United States, there has been an initiative where they developed an exon skipping medicine for one patient with a rare brain disease. And then we thought, well, this is something that we also can do. We have the experience to also develop these therapies for patients with very, very rare diseases. Especially when we can inject the exon skipping compounds locally. Then you have to think of eye diseases and brain diseases and maybe local muscle injections. So we want to use the experience that we have obtained during the past 20 years to help also these very rare patients.
Could you tell us a little bit more what this center could mean for patients with a genetic disorder affecting the brain?
Yes. When I started working here at the Department of Human Genetics, this was of course where the exon skip technique was developed. And through collaborations with Annemika, I started using this technique for hereditary brain disorders. And we already do this for larger groups of patients together with companies. But the nice thing about this center is that we can also apply this to smaller groups of patients. And we already have a lot of patient and family initiatives that come to us for help, like SCA3 families and the families with SCA1, but also the FOXP1 syndrome. And it's very nice that we now can also maybe help these smaller groups of patients in this center.
Could you explain to us what this new center can do for patients with rare diseases?
So most therapies for rare diseases are body-wide therapies. We however think that there is also a good opportunity for local treatments, especially in muscle diseases. Not all muscles are equally relevant for daily life. So it might be very well possible to treat only arm muscles to improve function. That already could make a big difference for the patients. And we think that with our technology, this could make a difference and we could help especially this group of patients. So I'd like to remind you that overall it's estimated that 8% of all people suffer from a rare disease, which altogether are millions of people. There are larger groups within there and there are very, very rare, ultra-rare diseases. So that means that there's only a few patients, a few persons suffering from this disease. And we think that for the larger groups, there are already some interested, some pharmacies, some others are doing investigations for those diseases. But for the smaller, more rare diseases, there are no initiatives to develop a treatment. So we think now we have a unique opportunity to look especially at those groups or those individual patients.